Okay, we have the great pleasure to have with us digitally a friend of mine that I'm really happy to call him a friend of mine, even if we've met only one time. I was a visitor with a group of friends and colleagues from Iași, narrative therapists, in his place somewhere in Greece, near the city of Volos, but somewhere in a rural area, at a farm, at a ranch. And I will let Danilopoulos to tell you a little bit about the context. You are there. You are in front of your home, actually, at your ranch.
Yes, I'm here in front of my home at my ranch. If you like, I'll show you a bit around.
Yeah.
So.
Yes.
And it's a great pleasure for me to talk with you.
Yes, tell me, you have sort of different identities that you play with as a professional in one. I know that you are a psychiatrist initially as a profession, so you are a child and adolescent psychiatrist, but also you happened to deal with training during your work, your career in narrative therapy. And then you also had to, you also had the chance to start working with or relating with horses. And you became also a person who is an expert in a sense with how to ride horses, and more on top of that, you are combining these three: psychiatry, narrative therapy, and horse riding in something that you call, in one of the recent articles in 2019, equine assisted narrative therapy. And what can you tell us a bit of your personal journey, personal professional journey of knitting, of connecting psychiatry, narrative therapy, and equine activities?
Yes, thank you. Initially, I was trained in medicine, and then I was attracted in child psychiatry because I thought that if we could intervene rather early rather than late in children's life, especially those children that are in trouble, we might be able to help them to have a better life. Mm-hmm. This is what attracted me in child psychiatry. Mm-hmm. So I studied child psychiatry, and it was a good experience, but psychiatry does not provide many ways to relate to people, and especially to children, in a respectful manner, and in a manner that honors their voice and their knowledges and their skills. Psychiatry is constructed around ideas of pathology, diagnosis, evaluation, either with medical investigations or with psychological testing. It's organized all around that. It's all around normality and pathology.
So but this, if I may say so, you are discussing about you got in your medical training and your specialization in psychiatry lots and lots of expertise, and you became one of the experts of this knowledge and skills, medical skills, psychiatric skills, and these orientation about symptoms and diagnosis and evaluation was between you and the children, between you and the adolescent. Yes. And you wanted that in a way to recruit something else, to recruit some relationship with them, some expertise of their own voices and lives.
Yes, exactly. And not only with them, with the children and adolescents, but also with their parents and their extended family. Pathology does not provide us many points of entry to get to know their stories, to get to know their lives, to get to know their values, their beliefs, their skills, the things they're fighting for, the things they stand for. Does not provide us with many of these opportunities. So a colleague of mine gave me the idea to start training in family therapy. Okay. And that's what I did. While I was doing the last part of my specialty in child psychiatry, I was in London then, I started postgraduate program at the Institute of Family Therapy in systemic therapy with couples and families.
Yes.
That's how I came into contact with narrative therapy.
Mm-hmm.
When I remember that when I read a single article of narrative therapy, the one that says externalization of the problem and reauthoring of lives and relationships, that was quite an experience for me because it provided me with a different point of view.
Mm-hmm.
And it was one point of view that could allow and invite conversations that were not pathologizing at all,
Mm-hmm.
that were quite depathologizing.
Mm-hmm.
For example, it's different to start talking with a child or with their parents about their phobia
Mm-hmm.
and the symptoms and all the stuff that are coming together with the phobia.
Mm-hmm.
And it's quite different to start asking about how they resist the fear. For example, when the fear does not let you in, does not allow you to get in the elevator, do you always obey?
Mm-hmm.
Do you always accept that?
Mm-hmm.
Or, for example, when anxiety does not allow you to talk to a girl that you like a lot, do you always stay silent? Or the opposite, to a boy or to anybody? And these kind of conversations were quite different for me and for them, for the kids and their families, because they were not feeling that they were having a problem, just that,
Mm-hmm.
but they were started feeling that in the face of the problem, they could do something, and they were already doing something before they came to me.
Yes.
Because I would ask, when did the problem invade your life?
Yes.
How did it do it?
Yeah.
What kind of situations or factors help the problem to get in your life and give you trouble? And how does it affect your body, your mind, your feelings? And how is that for you? I invite them to take a stance in the face of the problem, to take a position. And
Yes.
nobody liked the problems, nobody invited them, nobody wanted their effects.
Mm-hmm.
Everybody, almost everybody would like to resist.
Mm-hmm.
And this was a quite different view for me, one that attracted me very much.
Yeah.
And although I continued my training in systemic therapy,
Mm-hmm.
my focus was from 1998 to 99 in narrative therapy, and I started reading books and articles and using the ideas in my practice.
Yeah. One question, if you allow me.
Yes.
It's a
Stop me anytime and ask anything.
It's a comment first, and then a question. The comment is a reflection of what just you said, by saying that you are providing the child or adolescent and those in the family with a place from where they can stand and they can discuss about their problems, the fears, anxiety, whatever it is, and relating in a relational way, what is this a problem doing to them or affecting them? This is, you created a place in which you are not discussing only about the issue, the mental health trouble. It's not a problematic inquiry, but you are creating a space where you invite them to voice their knowledge about the issues that attack their life, and you are refocusing the attention to them in order to, in a way, you are not using a pathologizing discourse or a conversation, but in a way you are creating a personalizing conversation. You put the person first and you marginalize the pathology or the symptomatology or the issues that are affecting them. So in this way, you just defined that principle of narrative therapy. The person is the person. The problem is the problem. So we are separating, we are externalizing the problem from the life and the preferences of the person. And I think it's beautifully presented in this way. And the question is, you are in training after being in training and still being in training in residency and a specialization in psychiatry for adolescents and children. You are in training in systemic therapy, and systemic therapy have strategic, structuralist, has different little schools that are systemic. All of them are systemic, and then you get this narrative component. How come did you embrace narrative, and what is the difference, or how did you? How was your journey within the different types of systemic thinking and acting, schools, and you reached to narrative because narrative somehow it's attracting more of your attention, and how it happened to you, because it happened to me too, and also I was a systemic, then I embraced narrative more than other types of systemic therapy. What is your story about this?
Well, at that introductory 2-year course at the Institute of Family Therapy in London, we were taught about all different schools of systemic therapy.
Exactly.
From the initial psychoanalytic start, then there was more structural models like Minuchin, then was more strategic ones. The psychoanalytic family therapy is influenced by psychoanalytic theory and pathology.
Sure.
The strategic phase of family therapy is influenced by more mechanical ideas that come from different fields. It was about how the experts would manipulate the situation or the problem or whatever, but the experts would do an intervention to change the family.
Yeah.
Then there was other consequent phases of family therapy that more or less were extrapolating between the expert ones, those who know what's right, what's true, what's normal, what should be done in other people's lives, and so. And the other pole was about not knowing what is best for the person or the family or the system around them, not knowing the solution, not knowing what was the details of their experience and the consequence of events that led to the appearance of problems. We don't know that.
Okay.
This is the postmodern side in family therapy, which is about the expert being more humble, in simple words, than the other expert ones, the previous ones who were standing really high. They got the knowledge, they got the power, as Foucault says.
Yes.
Knowledge is power.
Yes.
Now, in postmodern therapies, we talk about sharing of knowledge, not imposing expert knowledge on people who are not having any kind of knowledge. It's about being really careful about how we will share expert knowledge with them.
Right.
And being really careful about how we express ourselves in ways that are respectful and not dominant.
Yes.
So more and more attention in postmodern therapies, according to my understanding, is focused around issues of power, how therapists and people who use therapeutic sessions relate between them, and a lot of attention is given to keep a balance between being respectful, being curious, and being not knowing about what's best for them, about what they should do, about the details of their lives. But at the same time, when we express expert knowledges, and even if we don't express expert knowledges, the fact that we are either psychologists, psychiatrists, psychotherapists, counselors, all this puts us in an expert position. So I think we should use this expert position very carefully and humbly. That's my...
And using this power to open up possibilities of expression of knowledge of their lives and possibilities
Yes.
for living from those who we serve. So from this point of view, just a very personal question. What is your explanation that you embraced the postmodern type of therapies, that you embraced narrative therapy, or maybe narrative therapy found you? Maybe you didn't find narrative therapy. Maybe narrative therapy found you and she just embraced you. I don't know.
Well, yes. Thank you for the question. It's a long story. I touch on it in another article that was issued on the Journal of Narrative Therapy from Dalwich.
Okay.
It's called Rooftop Dreams, and it's about work with a young man with drug and psychiatric problems.
Okay.
Well, while I was studying medicine and then in child psychiatry, I was never attracted to those figures of doctors or professors or whatever who were distant and who were all-knowing and who would not accept any challenge of their knowledge, who were not open to new knowledge, who thought that the trainees were ignorant. I was not attracted at all to those people.
Okay.
But I was very, very attracted to other teachers, doctors, mentors, whatever, who were humble, who were simple people, not being on a pedestal.
Yeah.
Who would listen to their trainees' questions, who would pay attention to the younger ones' curiosities, who would treat them with a lot of respect.
Right.
Those are the teachers that inspired me.
Okay.
And I was sitting to find this kind of teachers who were not knowing.
So
I would like to become this kind of doctor.
So you knew something about processes of inspiring. You knew already that inspiring is important, is moving, and it's championing an action towards something. And then when you found postmodern type of therapies like narrative therapy, you found some ways to perform yourself in this way.
Yes, yes. And because I feel I didn't answer very personally in this personal question, I'll tell you a more concrete story.
Yeah.
When I was about 3 years old, I had a really bad infection, intestinal infection.
Okay.
And I was dehydrated. I would die.
Okay.
A couple of doctors gave me medication, but it didn't help. And finally, my parents were quite desperate and called another doctor who was working at our area, who was quite known to be a very simple man.
Yes.
He was helping a lot of poor people. He was not taking fees from poor people. And he was known to be a doctor that would do the best he could. Well, he came, he saw me, he gave me a series of injections, many. From that, I got a fear of injections, which I realized when I was 17. Okay. I went to the local surgery to get a vaccine with my brother. And we were waiting just outside the room, and there was a little kid inside screaming to let him go and not give him the vaccine. Okay. I was 17 at the time. Okay. And then I stood up. I told the nurse, well, would you like to give me a vaccine so that the kid sees me and takes some courage and then have his own vaccine, right? She said, well, yeah, why not? All right. I got in, she gave me the vaccine, she told me, hold this cotton here. And I started to walk towards the door to get out. Yes. The next thing I remember was my brother next to me, sitting on the chair next to me, just outside, giving me slaps in my face, telling me, wake up, what happened to you? I had lost my senses. At the same time, when I started to wake up and open my eyes, the kid was coming out of the vaccination room pointing at me. Oh, ha, 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 ha.
Yes.
Look at him.
Yes.
Is this the guy who was not afraid and wanted to teach me how to not be afraid? So this is a funny story which goes with that doctor who inspired me, and also goes with the stuff that, although I always had the fear of injections, which I realized at 17,
yes,
I kept on having it while I was growing up and having my medical studies.
yes,
Narrative therapy helped me get in contact with things that I personally did to resist this fear. For example, when I had to do my military service, I had finished the school and I was working with other young doctors, soldiers who had just finished their school.
yeah,
I told them once, I'll give myself the vaccine so that I'll try to deal with the fear. If I lose my senses, putting me on the bed, and I'll be fine in 5 minutes, which I did. I got a bit dizzy, but I didn't lose my senses.
yeah,
The fear followed me even when I had to give injections to other people. For example, it was my time to give a vaccine.
Sure.
There in the army, there was one guy, very thin. And what did the fear tell me? If I give him the vaccine, the needle may touch on his bone. That was unbearable, and I got sweat running over my face. But I did it, and generally I kept on doing what I had to do.
Yes.
With people, then with horses as well.
Okay. Yeah.
I'll put a stop here because I think I said too much.
Okay, so I understand the narrative was a way for you to be aware that even if fear may be present with you, even during all your life in different situations, you could also realize a counter story, a counter awareness that you have reasons and you have small actions or important actions to face the fear because there is something really important you are performing in that moment. And this tells a story about how you stand up to fear, even if fear may be present as a human condition, as a human experience. Yes, I understand.
Exactly.
Coming back to you being more and more in touch with narrative practices and practicing psychiatry. You practice psychiatry fortified with narrative therapy knowledge and skills. This humility, is this relationships that you're creating making you less of a doctor? Or how it was that?
Well, no, it's not making me less of a doctor because I take the responsibility that I've got as a doctor. For example, if I am asked to see a child or an adolescent who may be having different kinds of problems, for example, anxiety, depression, sleep problems, bowel problems, many different problems. There are certain things that I have to do as a doctor, as a medical expert. For example, to inquire about pathological factors, clearly pathological factors that may play a role in a problem or in a child's behavior that may trouble the child or the adolescent or the family, teachers, and so. For example, there are certain situations in which people have psychological troubles, but it comes from a body problem. For example, thyroid problems with the thyroid gland.
The gland,
may cause a lot of upset. Or there are other situations in which problems with food intake may lead to increased anxiety or increased vulnerability to depression. For example, people who suffer from gluten
sensitivity,
celiac disease. Those who cannot tolerate gluten, substance that is found in bread and this kind of food. they may have serious problems with anxiety, depression, and stuff like that.
Sure.
So I take the responsibility to investigate with them all the medical stuff in order to rule out possible factors that may help the problem.
Yes.
For example, a thyroid that is not working well may help anxiety, may help fears,
sure,
to give the child a hard time.
Sure.
So, but this may be done in an initial meeting with the parents only. I prefer not to ask all this kind of medical details in front of the child, because this may put the child in a quite difficult position and may give the child the message that I've got the problem, or that I am the problem.
Right.
And we don't want it.
You don't want that. Yeah.
No. No.
Good. So you are doing your doctor business, but on top of that, that is, you may single out symptoms, you may identify syndromes or a diagnosis. You may even offer them the possibility to take some medication if necessary, or referrals to a different doctor if necessary, if there is an organic cause or an added organic cause that may intensify their feelings of malaise. So, and on top of that, you are doing certain things narratively in the way you are talking to them, or you have an intervention, a narrative therapy conversation. How is that done? Is it done in the office, or you can do it here at the ranch if it's about inviting them to work with horses? Now I'm trying to move into this next stage of your career and how it is working. So how are you appealing with narrative therapy if you are in a cabinet, for example, without the horses?
At the office, you mean?
Yeah, if you are in the office, you may use a narrative therapy there too.
Yes, always. I work narratively at my office. Yes, almost only. I also use ideas from other postmodern approaches, like, for example, solution focused. I use this kind of ideas, but mainly I work mainly narratively. When usually the parents ask for an appointment, ask me to see their child. Most times I suggest that I meet with parents only first, because they ask me to see them, and as a child psychiatrist, they know that I'm a doctor, and many of them expect me to rule out certain possibilities and offer them my opinion on what's going on with their child. So I try to do that not in front of the child.
Not in front of the child. Yeah.
Not in front of the child. Once I talk with the parents, and one part is to understand the medical side. The other part is to understand the story of the problem. I ask them to tell me when that problem came into their child's or to their family's life. When did they first recognize that something was not going well? How did it manifest itself? Who saw it first? How did it affect them? When did they start thinking about taking some action to deal with it? How do they name it? How do they name it? How do they prefer us to call the problem during our discussions? So in this way, by naming the problem, we co-construct a different language than the one that is the usual language. Most people expect the doctor to tell them what's the name of the problem.
Right. So they take the expert name and they use it because it comes from the powerful expert, the professional. But in your case, you are creating a space that they can propose their understanding, their names, their language.
Yes.
So this will be the story of the problem and the effects of the problem in the parents' language.
And also, I'm interested to discuss about how they reacted, how they resisted the effects of the problem.
The responses.
Yes, for example, when you recognize that your child is afraid of the dark at night and tries to come to your bed and stay there all night.
Yeah.
How do you feel about this? Is it something that you like? Is it something that you wanted to happen? Is it something functional? Is useful in something? Is it something that you would like to change? Is it something that you already tried to change? In which ways did you try to change it? Did your child do some efforts by itself?
So there is a lot of exploration about their knowledge and their relationship with the problem and the effects of the problem and their responses to that. And in a way, you are inviting them to explore their own experiences and their own knowledge and to describe it to you. It's a way of putting them to narrate, to tell the story of these experiences. Yeah.
Yes.
So this is narrative indeed.
And I'm particularly interested. And I'm particularly interested in the choices they made and the steps they took to resist the influence of the problem before we meet.
Okay.
Because this is their efforts with no influence from me.
Yeah.
Some people, when they schedule an appointment, for example, when they ring to ask for an appointment, they already have done steps, have done things to resist the problem.
Yeah.
Some people, many people, after scheduling the appointment, at the interval between the call and the actual appointment, they have done even more steps.
Sure.
This is pre-therapy change.
Yes.
Which is quite important because it is the cornerstone of narrative conversations.
Yes.
In which we want to build on what is already happening.
Absolutely.
As a resistance to the problem. This is their reauthoring. This is a reauthoring about their story that includes everything they did until they came to the session. It's a good start to build on it and maybe inspire them to go home, the parents, and speak with the child in a different language.
Yes.
Talk about our conversations.
In this way, starting to engage even more or continue or expand what is already happening in the knowledge that already have. Yeah, in the relationship with the child. Yeah, I can see that.
Yes. Yes.
And then?
And then I may see the child in the way that the child prefers. Some professionals want to see the child on their own, on its own. I don't think that's fair to the child because I am a stranger to the child, and why should they want to meet with me?
Yeah.
No matter if their parents told him or her good things about me.
Yeah.
Why should they want to? Why should they feel safe with me? Why should they feel comfortably in my space at my office? So I suggest to the parents to talk with their child, to give a short description about what we discussed, if they like, to tell them that I'm a person who wants to assist them to have good times and get over with problems. And I suggest to the parents to encourage their child to talk openly about what's bothering it and about solutions that they have attempted.
Okay. The way you talked with the parents. So practically, in a way, your conversation with the parents is giving them ideas, is supporting their discussion or presentation for the child of what will follow with them, with the children when you meet with the child. Yeah, I can get that.
Yes.
Good.
And it's up to the child to choose if he or she wants to meet alone with me or with the parents. But again, I usually, during the first 5 minutes of the child sessions, I suggest that the parent is there, and I say a few things about confidentiality. For example, I say to the parents and the child that I will not do anything secretly. I will not tell nothing to their parents secretly. That if I need to discuss something with their parents, I will take the child's permission first.
All right.
And several things like that. I don't want to expand.
Sure,
now.
sure. You are creating a safe space for the special relationship that you start with the child. Yeah.
Yes, yes. And then it's up to the child to decide if they want to talk with me on their own or if they want somebody else there, and so. And during the conversation with the child, I want to have their view about how the problem is affecting them, but I also have their view about what they've done to deal with it.
Yes. Their responses, their resistances, their actions. Yeah. Yeah.
Yes. Yes. And also the reasons for these responses, resistances, actions, which goes to their values, to the things that they believe that are right or wrong.
Yes.
And this is an opportunity to expand the discussion to the area of their knowledges and also their beliefs, their values, their reasons.
And the skills. Yeah, the abilities. Yes, yes.
Of course.
So this is a reauthoring part of the conversation in which you are supporting the child or adolescent to describe himself or herself more fully in the light of intentions, preferences, dreams, and hopes, and also their skills and knowledges. So a rich description of who they are, how they are, what they prefer is developed slowly and slowly in contrast with what would be the problem story, the issues they were brought in initially in the interaction with you. Yes. And this is like a regular narrative therapy, a conversational narrative therapy in the office. But at a certain point, I'm not sure if it is a good point for inflection or not. If you want to say something more, you may add something more about that. But I wonder now, what prompted you to get out of your office? What prompted you to discover a horse and how the horses enter the scene?
I'll tell you.
Yeah.
It was back in 2003, I think, that we went for a horse trail with Penelope and some other people. I had nothing to do with horses by then.
Penelope is your partner.
Penelope is my wife.
You're right. Yeah.
My wife, who was at that time working as a preschooler's teacher.
Okay.
And we went for a horse trail ride with some other people. The first day was great. I was riding the horse and everything was fine. I had no idea about horses.
Excuse me. Horse riding was for you to learn how to ride the horse.
No, in several places in Greece, you don't have to learn how to ride a horse. We didn't want to do professional riding.
No.
You can just go for a walk with a horse outside in the country.
Okay.
That was it. A trail ride.
It was for your experience.
Yes. Nothing therapeutic here. Nothing. It was just Yes. It was quite nice, but I had no knowledge about horses. I was just wearing the protective helmet and did what they told me to do. First day it was great, but the second day I was the last one in the row. We were about 10, maybe more people, and I was last one with my horse. The others reached at the beach with sand and stones. And as I was approaching them, they started galloping across the beach.
The shore.
My horse, across the shore, but my horse was the last one and wanted to catch up with them. So he started galloping really fast. Galloping, going very fast. I felt I would lose my balance and I would drop. And I thought, if I manage to get my foot off the stirrup, you know, where the foot hole,
Yes.
when we ride the horse,
Yes.
if I manage to get my feet off the stirrups and jump on my own, the harm would be much less than if my foot was blocked in the stirrup and the horse drags me with it.
Yeah.
That's what I did.
You wanted to fall safely, safer.
Yeah.
Yeah.
And that's what I did. And I managed to do that, and I fell, and I had the back pain for a few weeks. But it was impossible for me to stay mounted on the horse.
Yes.
That was not a good experience. And then I didn't want to be involved with horses because I was afraid of them.
Yes.
That was me. But Penelope was loving horses even before she met me.
Yeah.
She had ridden horses several times. She had gone safari at Sahara Desert
Wow.
with her then partner. And this was an amazing experience. I knew that she loved horses, but I couldn't go close to them because I was afraid.
Yeah.
Then at 2004, she I was then working at some structures of local municipalities, some structures for disabled people, day centers and so on.
Yeah.
And I found there a leaflet that was saying that a therapeutic riding seminar would be performed in one of the riding clubs of our area. I was not very excited for myself. I didn't want to attend, but I thought that Penelope might be interested. So I gave her the leaflet.
Yep.
She wanted to go, but she missed it because she fell sick. She became sick. But she went to that riding club and met with a physiotherapist who was offering therapeutic riding sessions then.
Yeah.
The physiotherapist invited her to go and work there voluntarily as her assistant.
Right.
Penelope started going to the riding club and worked as voluntarily as an assistant of the physiotherapist, and she also started riding lessons for herself to learn proper riding.
Right.
After a few months, the physiotherapist quit. She left.
Yeah.
From the club, they asked Penelope to take up the therapeutic riding lessons. Penelope didn't feel comfortably about that because she was a preschooler's teacher.
Yeah.
But the physiotherapist left anyway.
Yeah.
Now, she tried to offer a few sessions, but it was not easy because she didn't have much experience.
Sure.
The parents of a couple of kids knew all the exercise. Those were kids with motor problems.
Yes. Disabilities.
Cerebral palsy, and so. The parents knew the exercises, so they encouraged her to do work with their kids.
Right.
At the same time, she was progressing with her own riding lessons.
Yes.
She was riding Rados. Rados was a racehorse, a thoroughbred.
Yes.
At some point, they told her to wave goodbye to Rados because they would send him to a nice field where he would graze and he would be happy and calm and so. That meant that he would be sent to be slaughtered in Italy to become salami.
Yeah.
She was shocked. And the president of the riding club offered her a chance. She told her, this will happen unless you buy Rados.
Yeah.
And he named the price. Penelope came at home and told me, being very upset, that they wanted to send Rados to the slaughterhouse unless we bought them.
Yes.
Until that time, I hadn't gone to the riding club, not even once.
Yeah.
None.
It was only her activity.
Yes. But I knew how much he loved Rados, the horse he was riding. He was
Rados
talking
the
about him
horse.
every day.
Yeah.
The horse,
Rados
yes,
the horse. Yeah.
the horse. If you or your students, your colleagues are interested to have pictures around that, you may visit the website of Politropo,
Okay.
a non-governmental, non-profitable organization with which we do our efforts here with therapeutic riding and equine assisted narrative practice.
Yeah.
I'll send you the website later.
Right.
I knew that she loved him, and they told her that they would kill him because they didn't need him anymore.
Yes.
And they didn't need him anymore because he was quite old, 14 years old.
Yeah.
And because he would startle and drop the riders.
Right.
So I couldn't accept that.
Yeah.
We went together at the riding club, and when I saw Rado's eyes, I said, no, that's impossible. We cannot allow that to happen.
So you were conquered. You were conquered too.
Absolutely, absolutely. I was abducted from a previous life. Abducted from my previous life.
Yes. Okay.
Me.
Yes.
So we bought Rados. I started going there, doing things with him and with Marcos.
Marcos, the second horse.
The second horse. We bought Rados at 2004 and Marcos at 2006. And we left that riding club in a quite, how can I put it? Quite adventurous way, I would say. Yes.
Is it
at 2005? Please say it again because I couldn't recognize.
Yeah. It was the time in 2005 then when you started your
Yes, we started thinking about having our own farm from 2004.
Yeah.
But at 2005, there was a training program for therapeutic riding instructors at Athens at the therapeutic riding
association.
I don't recall the name.
Yeah.
Association of Greece.
Yeah.
And we went there and we both trained as narrative therapists, as therapeutic riding instructors.
Yes.
At 2006, things at that club were going really bad because they didn't want disabled people to enter the riding club. There was some kind of racism there, where the able-bodied ones would enter with their cars.
Right.
And one person who was using a wheelchair would have to go with a wheelchair in a quite steep part of the entrance. We could not accept that. They also neglected our horses' food.
Okay.
They didn't feed them well. And generally, they were treating both the ones who were receiving therapy and us as unwanted. And at the end, we had a great fight with them. We threatened them that we would take pictures and videos and get it on the news.
Right.
And animal protection services and stuff like that, unless they sold us Marcos to take both Marcos and Rados and leave.
So you were fighting at this moment. You and Penelope, you had to fight. You are fighting for the horse's dignity. You are fighting for the children with disabilities dignity.
Yes, absolutely. Absolutely.
So
we couldn't accept that.
It was a moment of sort of political engagement for you.
You may say that.
Yeah.
Yes, you may say so.
Yeah.
It was a political engagement. It was a stand we took against discriminations, against racism, both disabled people and animals.
Yeah.
Yes.
Okay. And then the new story starts, the story of having your own ranch, if I may say so. Is it ranch correct, or how you call what? What is your name for the place you have?
You may say farm, ranch, whatever. You may say there is a piece of land in which we inhabit together with our animals.
Piece of land. Okay.
We are passengers from this place.
Yeah.
We stay here for how long we will stay, and then others will come. And we try to create a place here where there is respect for diversity, respect for vulnerable people and animals, a place with peaceful coexistence, and a place that we hope that may host activities and conversations that are helpful for people.
And if I understand something from my visit, when I saw both horses, Rados and Marcos, and you showed us how you care for them. You told us the stories of their illnesses and how you care for them. Actually, you prolonged their lives by this very personalized care. And also you showed us the strategies to do horse riding with children and their families using narrative therapy. Is this narrative therapeutic way of relating also engaged with the animals themselves? Is it narrative therapy also in the way you are working with the horses? Not only
yes, in a sense,
with the children.
In a sense, yes.
Yeah.
Yes, it is also with horses, because since the time that I started being in contact with narrative ideas, I started thinking as problems being separate from people and other animals as well, because we are animals too. So I was on the lookout to recognize any kind of resistance from the part of our horses towards the fear that they usually feel, and the anxiety that several procedures and situations may cause them.
Right.
I'll tell just one example. As I said earlier, I had the fear of injections from a very young age, which I came to recognize, to conceptualize when I was around 17. The fear was present even when I had to give an injection or to take some blood from a horse to test it.
Right.
That was quite trying. But there were times that I was trying to fight my fear of injections. It was not a fear of injection. It was a fear that I may cause harm to the horse than doing good. Right. That was the fear. It took this form, right? And it was also a fear that I will not do it correctly, that I will cause pain to the animal, unnecessary pain and stuff like that. Yeah. But there were times when Rados became ill back in 2007, when I had to give him IV injection of antibiotics, which is quite complex procedure. But I was amazed by how cooperative he was, as if he understood that I wanted to do him good. And although the injection was aching, he was standing still, not moving at all. That was amazing, because when I started recognizing it, that horses all the time do things to keep themselves safe and protected from dangers. So fear may be a problem at some degree, but it's also a protective
experience
of the horses. So it is not an issue to create people or horses who are fearless. But for me, it's an issue to assist people and horses change their relationship with fear or anxiety or any other problem, and make it such that is useful for them, that does not stop them from doing things they want to do. The effort here is to assist people and animals to resist fear and anxiety at the times that it's unnecessary. Horses may start galloping even if a mice
it comes in.
Comes in. It's not usual. It's more usual with elephants, I think, not usual with horses. with
Right.
horses, but even rapid movement of a plastic bag,
Right.
something may cause the horse
Yeah.
great fear.
In a
Without them,
way, Daniil, in
yes,
a way, sorry if I interrupt, in a way, what I understand is that you are modulating, you are creating spaces and possibilities of interaction that not to become fearless, but to have a certain relationship with fear that makes possible what is important. And I think the title of your paper that you sent me recently, it is about trust, not fear. It is
yes,
creating possibilities for something that is highly desired, like feeling secure, feeling that it's a trusting space, it is a
yes,
safe space. Even if fear exists for whatever reason may be, the possibility to recuperate and construct the trust. So in a way, the way you relate narratively with the horses, as you do with the people, is not have a work against the problem or against the
yes,
fear. It's not a fight against, but it's how
yes,
to construct or re-engage possibilities that despite the problem, in this case, the fear or anxiety, you can reach the aim. And the aim in this case is trusting relationships, safety, security, wellness.
yes, yes.
Yeah. What cat do you have
Um,
now in front of you? Who
my
is
cat,
she?
it's our cat. She's Lucretia.
Lucretia. Okay, welcome, Lucretia,
Lucretia.
to our conference.
Yes, yes. Um, yes, and I'll tell an example on that.
Yeah,
Before 2009, that I started the narrative therapy training, the proper one,
yeah,
because before that I was only studying in, articles and books on my own. Before
yes.
that, I had the false impression that it's okay to talk about problems as if they are enemies.
Mm,
But
mm,
while we were doing a therapeutic riding program back in 2007, 2008, there
yes.
was a young woman who had problems with instability. She
Mm,
couldn't walk in a very stable manner. She was feeling dizzy sometimes.
mm,
She had trouble standing and walking
right,
freely.
right.
So while we were talking and I was encouraging her to resist the fear and try to mount on Marcos and go for a ride,
Mm,
we also discussed if the fear was giving her trouble in other situations apart from the horses. And she
yeah.
said yes, but sometimes fear is useful. For example, if I have to go upstairs or downstairs,
Yeah,
and use the stairs,
yeah.
fear helps me not to rush, to be very careful, to go step by step
Hmm.
and be safe. So
Okay,
fear has some usefulness then.
right.
And this realization opened up space to discuss with people about
Hmm.
times that
Hmm.
what appears as a problem
Hmm.
may not be a problem, but may be something useful so
Hmm.
that they stay safe.
Hmm. In a way, you are
Uh,
describing now that you are very open to learn from your patients, from
yes,
your, yeah,
of course.
yeah.
They know better. They know their lives, the details of their lives. They know their stories. They know what influenced them. They know who inspired them. They
Hmm.
know in which situations they are in a better position to deal with their problems.
Hmm.
They know how they want their life to evolve. They
I
have
have a
dreams.
question. I have a question now that we are sort of wrapping up after this hour of three stages of your life.
Mhm.
Development as a psychiatrist, getting in touch with narrative therapy and finding resonances with the principles and positions in narrative therapy, discovering the horse, loving the horse. In this story, Penelope had an important role. Her passion also was a bridge for you to get closer to the horse and then to apply this understanding of life by having possibilities to relate with life in an externalized way and a reauthoring way. Now, if Marcos could listen to our conversation this
Mhm.
hour,
Yes.
What do you think Marcos would have to say what to do when he would listen to your life story? In a way, it's a life. You do this for a lifetime almost. There are some years you're doing psychiatry and you're doing these. What Marcos would say if he could be able to speak or to do something, what he would do or say?
Well, I think Marcos would say that we are his family.
Yeah.
And we say that as well, and we feel that way. Me and Penelope, we don't have children. We
Okay.
wanted to, but we weren't able to have children. And we feel our animals, our two horses, our dog and our cat, as companions and as family.
Yes.
And I think that Marcos would confirm that. Because both Marcos and we have another horse now, Chloe.
Chloe, the third.
Yes, there are pictures on the website.
Okay.
Rados passed away in 2017.
I didn't know. Okay.
Yes, he passed away in 2017 after 10 years of living with lymphangitis. This is an infection that causes the horse's foot to swell very much.
Yeah. I remember you taking care of that very, very closely.
Yes. And now our family is composed of Penelope, me, Marcos, Chloe.
And Chloe.
Hercules is our dog, and Lucretia is our cat.
Okay.
Yes, and I think that we are lucky enough to have those animals in our lives. I think that they may be lucky too. We weren't lucky enough to have children of our own, but we are very lucky to try to be in a position,
right,
to have opportunities to be helpful to any children.
Right. So in a way, you are all a family, a therapeutic family.
Well, yeah, in a sense.
In a sense.
Yes.
In a sense. Yes. What
Penelope,
it is for you? Yeah, go ahead. Finish your sentence.
At 2006, because Penelope was not feeling very comfortable to do therapeutic riding with people who were having mobility problems and orthopedic problems and stuff like that, she took introductory exams and she entered the physiotherapy university school, which she finished at 2010. She was so inspired by the horses and therapeutic riding that she went back to university to study at age 32. Yes. Penelope is the protagonist of all this story.
All right. So you two sort of having through passions. You have two passions. You came in with a narrative passion and practice, and she came in with a love of horses and also the knowledge about therapeutical riding. And this is how you created this possibility, this complex service or unique service, which I understand in Greece, there are other people doing therapeutic riding. It's an association. Yes. This thing has some history in Greece. It's not something recent, and you associated with. But the uniqueness of your work, you and Penelope, is that you are adding also the narrative component, narrative therapy component to it.
Yes.
What it is for you now in the end, then I will take some outsider witness reflections from our participants. What it is for you to have shared with us this recapitulation of life, the synthesis, these little examples. How do you see yourself and how do you see your work through the lens of this story?
Well, it's a good opportunity to resume the story of my life, or at least that side of my life that has to do with work and also my relationship with Penelope and with our animals. It's nice to recall all these memories, and I wouldn't change anything. I mean, I'm happy we made these choices and we live this kind of life. Although we are having hard times. For example, now we can't have sessions in which the children or the adults may ride the horse because Marcos is too old to ride him. He's 31 and a half years old. If he was a human, he would be more than 100 years old. But he's still alive and he's still well. And he's a good companion for us, a good friend, and we don't want to ride him. And Chloe, our new horse, is not still ready, and we are not ready to do work with kids, to do therapeutic work, because we need more time and experience with her, so that she trusts us, we trust her, and then invite other people to enter this circle of trust and do that safely. So at the time, at the moment, we don't offer.
This conclusion is like trust needs time to grow, and there is a careful, growing of trust.
Very, very. It's like weaving threads between them, one thread at a time.
Right.
And the invisible rope of trust that connects us becomes stronger, little by little. It is the same with people and horses, I think.
What do you think is sustaining? What do you think is sustaining this step-by-step process, ongoing process of increasing these relationships filled with trust? What is sustaining this?
Well, as I said, there may be hard times. There may be times that I will become upset, I will shout at the horse or behave not in a very kind manner. As on relationships, there are crises in people-animal relationships too. But what sustains us is that when we approach the horse and we are in a calm situation and we connect with them without imposing things, the result is very rewarding, because the horses, they want to please us, and other animals too, but with horses we see that very clearly. Once we are good with them and kind and caring and ask things in a language that they may comprehend, they are very cooperative.
So it's an exercise in, I can hear it's an exercise in kindness. Yes, because they are already ready to give you kindness and generosity.
Yes. The horses are very kind.
In a way you say, I am approaching them. Sometimes I have the disponibility, the availability of my peacefulness and capacity to give them kindness. And then the two kindnesses grow with each other and you create this special relationship.
Exactly. And also horses are very sincere animals, are very honest. And what they feel, they show it very clearly.
What you feel is what you get. What you feel is what you get.
Yes.
Honestly.
And also, they have the fantastic ability to forgive. If you treat them wrong, they may threaten you. They may turn their back and give you a kick. But if you treat them right, they forgive you and are still connected with you.
So you can restart relationships, relating.
Yes.
So kindness, honesty, and forgiveness. These are facets of what is sustaining you.
Yes.
In this project.
And also the fact that we are always learning their language. We are students and they show us and we learn their language. It's the same with our clients in therapy. We try to learn their language and talk in this way.
In a way, it is leaving aside the language, the human language, and be able to learn the other languaging of relationships, bodily language and caring language of caring, of respecting, of being attentive to, of taking into consideration. Thank you very much. If you have a question for me or for the audience, before I give, I will ask the participants to reflect on what attracted their attention. If there is a sort of a final word from you, if you want to add something or ask me something.
I would like to say that this path is not an easy one.
Mm-hmm.
I mean, it takes a lot of effort. It takes a lot of labor work. It takes a lot of energy, but it is very rewarding one. I was attracted in therapeutic riding initially when I was invited to help Penelope as the horse guide. I was leading the horse from the ground,
right,
with a halter and a rope.
Mm-hmm.
It was one of our first sessions that we were holding at that first riding club where we met our horses.
Mm-hmm.
And we were working with some children with mobility problems. Those children would have a really wide smile on their faces when they were riding the horse and performing several exercises. I had never seen such smiles in therapy in closed spaces, in my office or in any kind of buildings. I've never seen people and children with problems smile and having such a wide smile. They were smiling with all their body, not only with their face. That was impressive. I thought that if we could create this kind of space and do things and talk about things with people, this might be helpful, might open opportunities for them to continue their life with more satisfaction, with more peace.
Plentiful life, a larger experience of life. I can see a little bit more now through the image of this example that these smiles that could not be seen just in a room, you could see these smiles because they were smiling with their whole body. So in a way, I can see this equine assisted narrative therapy is a full body interaction. It's not only languaging, but it's more complex than that.
Yes.
Thank you very much, Danil. Yes. Thank you very much, Danil. It's such a wonderful moment to reconnect and to get a little bit more sense. We will stop here, and then I will invite the participants live to get some resonances. And if we are happy to have you online, we may even have some final responses from you too. If not, I will send to you all the ideas that we discussed in the resonances, and you may respond to them later on. We may get online as a follow-up session later on. Send my love to Penelope, and I'm really curious to see your full family. That is with the cat and the dog and the horses.
It will be our pleasure to have you here. Send my greetings to Aliona as well.
I will. All the love from the narrative therapist from Iași who visited you.
Thank you.
We'll be in touch soon. Next Saturday. Bye-bye.
Bye-bye.